coming in and out the house as well because we were doing that. So his first few days in the world were really lovely and calm, and it gave me a chance to really strongly bond with him as well. So my birth, the lotus birthing, the breastfeeding, everything I felt was just done in such a lovely way that it was. I feel very strongly that I had such a good experience, and it's one of the reasons why I really advocate that women do give the VBAC a go. Obviously, there are times when it may not occur, and don't beat yourself up on it if it doesn't happen, but at least give it a try.
Yeah,
I think.
Did you want to share another story, Sandy? Of a lady
I
who...
wanted to just talk a little bit about... Gosh, where is it? Here it is.
Got paper everywhere on the floor here.
It's everywhere. A study that I was reading from... The Journey from Pain to Power, Women's VBAC Experiences. This was written by Hazel Keedle, Virginia Schmide, Elaine Burns, and the well-known Hannah Darlin, midwife from Sydney, the College of Midwives in 1917. VBAC can be a safe and satisfying option for many women, yet rates of VBAC remain low in the majority of countries, including Australia. VBAC in a variety of locations was explored. So in 2011 we had 32% C-section. I think that's now gone up to overall, I think we're 34%, so an increasing caesarean rate. So when women have a caesarean, we call that the hurt me. And then that moves on to the journey, which brings different peaks and different troughs. And then we lead on to the next part, which is the successful VBAC, which is the powerful me. Mm-hmm. And then we have the ongoing journey. So the conclusion to this survey, women undergo a journey from their previous C-section with different positive and negative experiences as they move toward their goal of achieving a vaginal birth after a caesarean. This journey from pain to power is strongly influenced by both negative and positive support provided by healthcare practitioners. Positive support from healthcare professionals is more common with confident practitioners and continuity of care with a midwife. In 2013, 12% of women had a vaginal birth after a caesarean. So it's not a very high percentage. Most women have a repeat caesarean because they are unaware of the option of a VBAC. Qualitative international studies on VBAC focusing on women's experiences of VBAC across different birth settings and models of care. The different themes that were discussed were conflicting advice, being provided information, risk, friends and family, the media, women's preferences, understanding the information that's given them, support for VBAC, fear and anxiety, control, postnatal debriefing, mother birth, childbirth, surviving the damage, inadequate bodies, choice and control, fearing and trusting birth, my body failed me, negotiating the system, minimising or overestimating risk, being supported, violated expectations, the importance of vaginal birth being reinforced, and the health professional's language quite often sows seeds of doubt that can lead to the cascade of interventions, surgical birth and separation. And the language that the professionals use makes a huge difference for people.
Absolutely.
You agree with that,
Absolutely,
Andrea?
yeah. In my first, I kept being told that I was failing
to progress.
Failing,
yeah.
Constantly failing.
FTP,
yeah.
failing.
And they, even when I got the information about doing this VBAC, it was all about how I have to endure a trial of labour and how I'll have to we'll have to see if I can manage it. We'll have to, we basically will try things out. It was never that you will do it. There's never that yes, we can. There was never a positive attitude. There was never a positive encouragement. It was all about, well, we'll try, but there's lots of buts. And then but if it doesn't work, we'll do this, and then we'll do this, and we'll do this. And there was lots of information about all the things I'll do after I failed, but not a lot of information about how to succeed. Yeah.
The language around childbirth is very medicalised, and so many frightening words are used. And if we make the language more positive, it just makes for a far better experience. And with the Wise Hippo, we teach women to talk about not their due date, but their estimated due date. They don't talk about their waters breaking. They talk about their membranes releasing. They don't talk about pain or contractions. They talk about surges, pressure, sensation, tightening. We don't talk about the birth canal. We talk about the birth path. We don't talk about pushing. We talk about birth breathing and humming and toning. We don't talk about complications. We talk about special circumstances and many other words. So we just make it's the same thing, and women understand what it means, but it doesn't have to be put in such a negative way. And another couple, I'll tell you, we don't say the mucus plug. We talk about the uterine seal. And we don't talk about the bloody show. We talk about the birth show. And women aren't effacing and dilating, they're thinning and opening. It sounds so much nicer, doesn't it?
Absolutely.
And can we talk a little bit about like birth imprints? Because I think a lot of this language, although that's quite medical language, but just in the media and the way that people talk about birth and the birth stories you hear from when you're very young, and that imprints on you, and I think that can contribute as well to birth trauma and sort of playing out that fear and those stories in your own births. Could we talk a little bit about that as well?
I wish I could remember the name of the gentleman that wrote it, but there was a doctor that wrote a book about imprinting. Do you remember the name of this author? But he talked about we don't really have an evidence-based kind of assessment of this, but we feel that there's definitely imprinting that goes on when you think about the way that people fear.
Yarnov,
that's it, yeah. So he talked about quite a lot about the fear of birth and how it comes down to the entrance of our cells into the world, and how it's left us with the fear, and it can actually even cause our way of interacting with the world to be dictated by the way that we were birthed. So I think he mentioned something about caesarean babies sometimes feel like they do things, but they always need help at the very end. So
they need to be saved.
They
feel that the person in the white coat has to come along and save them from a situation.
Yeah, so that was quite interesting, I think. So I read that book a little bit before, I read the whole book before I had my second, and it did make me really think about what I was doing. I want the best for my children, obviously, so reading that, I thought, well, at least if I gave it a go, that's important for them, because I'm giving them that opportunity.
So this imprinting starts for the 9 months of pregnancy,
yes,
for the birth, postnatally, and right up until the child is 5 years of age. That's when the deepest imprinting occurs, according to Yarnov. And it does really make a lot of sense. Even the old adage from the old days was that give me a child until he's 7, and I'll give you the man.
That's true.
Yes.
I have heard that up until the age of 7, children are in this constant sort of hypnosis state. So you can, I guess it's like where their subconscious mind just absorbs everything. Is that sort of relevant to what you're talking about?
I mean, we talk quite a lot about 0 to 3 being really important years for developing the individual. If 0 to 3 is important, obviously the birth must be part of that process as well. So if you enter into the world with fear and a big flood of cortisol as your first experience, that must have some impact on how your brain starts to wire. We know now that cortisol has a massive impact on our brain wiring, and if we experience more traumatic events, the cortisol is raised, and it changes the way that we view the world. And we, have lots of different techniques that are used now by psychiatrists that help to reduce cortisol, change the way that we're wiring ourselves. So we can only assume that there must be something that's happening at birth if you're being flooded with cortisol as opposed to being flooded with oxytocin.
Yes, I think it's Michelle O'Donnell who says, the French obstetrician who is the pioneer of water birth. Michelle O'Donnell states in one of his books that during the birthing process, the mother's receiving her flood of hormones, the baby is receiving their flood of hormones. This imprints on the baby and has an effect on them for the rest of their life. It enables them to be able to give love freely and easily. So the more oxytocin we get at our birth, the more loving a society that we would become. Gee whiz, maybe that explains a lot of things.
So should we go and study C-section babies and see how many of them are narcissists?
Yeah, it'd be interesting to see, right? Yeah, it'd be interesting to see.
I just wanted to talk a little bit about negative attitudes from healthcare professionals regarding VBAC. It arose in 13 studies in Australia that were citing this. GPs, midwives, obstetricians often use words like catastrophe, dead baby, to coerce women into agreeing to their hospital policies, a lack of support and a lack of known choices. For example, water VBAC as an option in a midwife-led unit. Did anybody offer you that?
I was told that I would not be allowed. That was the specific words, that you are not allowed to do that in our hospital. There was no choice.
There is no choice. Some women found their carers to be supportive at first, but then changed their mind later in the woman's pregnancy. Barriers include threats of interventions, routine hospital procedures that are associated with VBAC, as you were talking about before, the continuous electronic monitoring with the CTG machine, with the big belt around you that always moves. And
they're always adjusting it constantly.
Constantly adjusting it, fiddle. And the machine has a very short lead. So
and it beeps constantly and makes you think that there's something going wrong.
That's right. And everybody looks at the machine. It's hypnotic. And the other things that happen during your labour would be regular vaginal examinations, perhaps an IV cannula in some hospitals, and active management of labour, which again puts restrictions, time restrictions on your labour. And it seems that women having a VBAC are given the time restrictions of a woman giving birth to her second child.
Yes.
When in reality, she is giving birth to her first child.
That's right, yeah.
Vaginally. So that sets up sets them up to fail, basically.
Exactly, and to begin that cascade of interventions.
Absolutely.
And which is what you've kind of really just outlined.
Yes. This is a barrier to VBAC. Midwives are focused on the protocols of the hospital and doing what was right for the hospital, but not doing much to facilitate a natural birth. Studies highlighted the positive influences that VBAC women need. They need to be encouraged and supported by healthcare professionals. They need social support from other strong women, and they need the support of their friends and their family. Women are very perceptive to healthcare professionals' beliefs.
We're well trained to trust our medical professionals, and we should trust them when we need information, when we need their services, but we need to also be aware that they have to operate under a certain policy, they have certain guidelines that they have to follow. There's also the risk of medical litigation that they perhaps are aware of. So they're going to be going for the safest option for them, rather than necessarily wanting what you want, because they do have to make sure that they mitigate their risks.
Yeah, I can't remember what it was that I was. I don't know where I get my information from sometimes.
You read a lot.
I think it might have been a podcast actually, or some sort of talk. where I think it might have been Deepak Chopra even, but he said that a lot of the time that patients are given drugs or like a lot of the decisions that doctors and things make for them are actually for the doctor's own convenience.
Yes, absolutely.
Like he was talking about this particular time where a doctor wanted to wake up a patient to give her her sleeping pill, and it was like, why are you waking her up to give her the sleeping pill? And